Hey everyone, welcome back to the channel. My name is Aryan Malik and I am currently a nursing student. Today is day 25 and we'll be continuing our discussion on fundamentals of nursing. Today we'll be looking towards what's the perfect drug card. So I've been looking at many resources on internet to find like a generic drug card that can help us remember the drugs better, and we're also looking at medication administration. So let's get into it. So when we talk about the perfect drug card, the first thing that should be there is the name, and a drug has two types of name, the brand name and the generic name. The NCLEX tests on generic name, so make sure that the each drug you put down has generic name, and usually every drug has just one generic name. And let's understand the distinction between generic name and brand name. So a generic name would be warfarin and its brand name or trade name would be Coumadin. A generic name is ibuprofen and its brand name can be Advil or Motrin. And then the most common one generic name is acetaminophen, or as it is called in brand name or trade name is Tylenol. So remember to put more focus towards generic names because that is what is tested on. And just to understand the difference between generic and brand name, so generic is the purest form, and the trade name is the name that is created by the company who has produced that particular drug. So let's understand this. So if we say we buy coffee is like generic, but if we go to Starbucks, they have their own names of the coffee, and when we go to Dunkin', they have their own name of the coffee. So coffee in itself is generic, but when we go to different brands, they have their own names. I hope this kind of helps make things clearer. The next important thing that you need to put down on your drug card is the drug class. So it is basically, it helps us to determine the pharmacological action, the desired action of that particular medication. For example, infectives, they are antibiotics. For instance, penicillin, then anticoagulant like heparin or warfarin, and then antihypertensives like barbitalol. The next important thing that you need to put down on your drug card is a mechanism of action. So, for instance, it's chemical action. How does the drug work in the body? For example, the drug penicillin, it works by breaking down the cell wall of bacteria to destroy it, hence helping us fighting through the infection. The next important term is indication. So, what's the therapeutic effect? What is the expected effect of the drug? So, that is what the therapeutic effect defines, and that should be on the card. And remember, one drug can have one, two effects at once. For example, antibiotics that specialize in ear functions, GI infections, skin infections, etc. The next important term to be on the card is side effects. For example, what are the expected effects of medication? For example, nausea and vomiting. The next important term is therapeutic effects. What are the expected response for medication? Example, giving Vicodin for pain, it helps decrease pain. Side effects, it's expected effects from medication. Example, gave pain medication and now the patient is experiencing nausea and vomiting. I'm now just describing the terms for you. Adverse effect is unexpected effects, severe response. For example, allergic reaction like hives, respiratory distress. Now there is another term called toxic effect. It's accumulation of medication in the blood. For example, overdosing, long-term intake of medication, difficulty eliminating the medication, maybe because of renal failure or in elderly patients who have reduced kidney function. We want our clients to be in a therapeutic range. So therapeutic range is basically a range which is kind of ideal. It is not too high, not too low, not too high, mean the level in which it reaches toxicity, and not too low that it is such low that it is creating no effect. So again, not too much, that will be toxic, and not too little, that will be ineffective. In the middle is where it's the therapeutic range, and that is where we want our clients to be. Now let's understand two more key terms. Synergistic effect. So it is basically when giving similar medication together, they have a greater impact than when given alone. For example, pain medication plus drinking alcohol. They are both sedatives and they make the body low and slow, causing massive drops. Another example is caffeine plus Adderall. Adderall is given for ADHD. They are both stimulants and can get you really up and wired, and they increase the heart rate and blood pressure. The last key term here is contraindications, when not to give a medication. For example, acetaminophen or tanolone should not be given to a client with a liver disease, because tanolone can be very tough, and when there is a kidney disease, the medication elimination becomes really slow, which can also lead to toxic effects. So just to look back on what is the perfect drug card, it should have the name, the generic name of the medication. It should have the class, what class it is, because that will help us in establishing a generalized action. It should have a mechanism of action, how the drug acts, and it should also have indication, like what is its therapeutic effect. It should have side effects, it should have adverse effects and toxic effects. So that will be your perfect drug card. I hope you found this video helpful. Please stay tuned for more videos that will be coming out in the future. Thank you for watching.